included with the well-known ingredients. You all hear about this today in detail. And we also have a skin clinic care regime for different indications. We will do today work with the skin cleanser, and we'll use some serums afterwards as well. Then I will show you a bit more about, it's got going forward, some indications where we can use microneedling. What we all know is scarring. Doesn't matter which scar. Can be a burn scar, can be operation scar, can be scarring due to acid damage in the skin. We can use microneedling to help there with these indications every time. The treatment against anti-aging, it's very common for face, neck, décolleté, also in other regions. I already saw it also on the hands and stuff like that, which is normally very hard to get even with surgeries. You can use microneedling on the hands with, for anti-aging treatments as well, very good. Treatment of laxity skin, so it's on the tummy, stria is a big thing for women, I guess, but also even men have these problems, especially if they train hard. The muscles are growing, and then also the skin can start to get stria. So I know, especially in Canadian market, there are some clinics which have 50% men's coat with hair loss and stria on arms and on the body. It works out for hair loss. You also the well done presentation before, and also against hyperpigmentation. Yes, it's a very important thing, indication being for you. Where I have to this shows some before and afters. You really see that you can achieve reliable results with a microneedling. On this skin, you say that it's before and after 3 treatments with a skin care on acne, scarring. So what you can see clearly is that the texture and tone of the skin is much better. The evenness of the skin has improved as well. So you can use this scarring very, very good. This is a horror indication. It's directly out from the hospital on burn scars. For sure, a scar will always be a scar. So we can't give 100% back. So what he has achieved here is really outstanding. You have, if you see the redness before and after, the skin is much more even, and also the flexibility. The picture can't show the flexibility of the skin, but due to the microneedling, the flexibility of the skin gets much better. This is a mesh, also after burn scars. The mesh will always be there. The hands you will see the structure, but here it's not about the texture and tone. It's also improved a bit, but the flexibility in the skin is back. Normally, with the patients with these hard indications of burn scars, they can't grab anymore. The scar is shrinking, and they can't close their hands. They can't close their eyes if they're burned in the face. And with microneedling, we can really help people which are suffering at that point. This is also a patient which gets burned in the face, very hard, and you see from the left to the right what is possible with very simple instruments, using microneedling to improve, get rid of the redness, and get back a more elasticity in the skin. This is a picture for women which gets tortured with cigarette and scars, and this is where this scar comes from. And this is just needling. One time, needling, 1 month after. And this is really what shows the effectiveness needling. This is another woman which gets tortured for cigarette and cigars. You see the really big things, they need surgery, but on all the little damages we can give help with needling. This is the same woman on the arm. This was also tortured with cigars. And they say that one scar is nearly totally gone, and the other thing is much more improved. And this is also just one treatment with the electrical needling device. This is a patient you already saw today. This is where we made the punch biopsy down here. This is the result we can achieve on the tummy on the laxity string. This is really a thing where a lot of women suffer with, especially in Europe. I know that in the Asian region the skin color is a bit different, but in the European market it really is a big point to take care after pregnancy without causing sphere on the tongue. This is just to give back some more flexibility, strengthen it into the skin, make the skin more even. It's laxity on the tummy. In the video, you see the preparation, and then afterwards you start with the gliding gel. I will skip this a bit to save a bit time today. I know you're all sitting here very long, and I will go into the details of how to work with the supplements and show this also during the live demonstration. So I will go forward over this. With this treatment, it was against anti-aging. The hair color isn't changed due to the microneedling. It was the hairdresser, it's not on me. But you see the improvement, what we can achieve as a result for anti-aging. Same thing, other women, also an anti-aging procedure with the XLRS Pro Twist and the XLRS Pro Skincare on another woman. This is anti-aging, how it looks like if you're in the treatment. You say also the shoulders and the neck can be treated, and you really see the difference between the left and the right. It is just also needling in comparison with some products. This is a sun damaged skin. In Europe, and also smoker, she was a very hot smoker also before. And as you see again, the skin is grey before. It really looks old, and now on the other side you see glowing skin, fresh, active skin. And this is what we want to achieve. This is one example in which it's very interesting also to give. It's before and after of the pigmentation correction. It always looks a bit different. I know that your patients will have another type of pigmentation, but the results will be same. They will be similar. We're all humans. It is comparable, and there you see what we can achieve just using microneedling and the pigmentation correction. Another woman, just pigmentation correction. You see from the beginning to 7 weeks later, and this was just performed with the home care roller. So no professional treatment, just home care, 0.2 millimeter needle length, and she used the highlight serum for 7 weeks, and the pictures talk so better. Really a great result. This was a colleague of mine sitting in the sales department, and she tried it on her own during the first implementation processes of the product, and she was very, very satisfied with this. On this picture, is melasma. You say what I'm talking about. So what you say, microneedling can be used for a lot of different indications. It's more about what are your customers criteria, what's your main focus you will need the microblading for, and hair growth as well. We all talked about this today. As mentioned, it's more men are taking this, but also it works out on women. A lot of women, especially if they're getting in the menopause or after pregnancy, it's good to give the body a bit extra to keep on the hair strengthness during that time. Again, hair rejuvenation. Here, an example from a woman which tried the product after 3 professional treatments for 12 weeks in total, and she uses also the hair growth serum in between. Men example again, 2 ones, also XLRS Pro, microneedling, and the serum to improve the hair growth again. This was from my side some impressions of before and afters, and now we want to go immediately over, I guess. Or no, no one stops me. So, give this to him. As you can see, the baby is already prepared, so I don't have to do the numbing anymore. We're just going to start with the cleaning process. Before, I will show you how to set up the device before. As you see now, the handpiece is without the cartridge. The foot switch is on the floor. I will use this during the treatment. If I start the device, now I say, okay, we will work with a needle length within between, I guess, 0.5 and up to 1 millimeter. Will be enough for a face treatment. I set up the device now, and then I can switch it off by the foot switch. I open the handpiece and see that the hook is right straight up. And now I can start by preparing . Open the twist device, and then you lay it in so that the tip is over the hook, placed in, and then you can close the fluffy mount, and the connection is fixed and safe. When I put it back in the holder, just everything here is prepared. And then you have some water that would be great. I could also use this NaCl. All right. Yeah, great. Just need once. First, I wipe off the onion. And you can ask questions from my side. I'm fine by asking questions in between. Of course, it needs always time for me now. If you have some questions within between, give a signal to someone of the team here to give you the mic if you want. I can talk in between, it's no problem.
Ê, mình vừa quay mình vừa chụp được không ta?
Được.
Bấm đây là chụp luôn đúng không?
Đúng rồi.
Hả? So you can see the face is now prepared. We will start on this side of the head. Normally it's enough. I need two hands. With one hand, stretch the skin. With the other hand, using the pan. The pan now has to be adjusted. And I put it down just for the first trial on 0.5 millimeter, just to see how the skin reacts. You lay it down with the center of gravity near the wrist, and then I lay down the weight of the handpiece on the skin. Now I don't have to touch the device or control unit anymore. I can stay here in the patient's area just by starting with the foot touch. I say, okay, the reaction isn't there immediately, we wait for a small moment, and then now I will start also to use the gliding gel within between. The gliding gel is the Cetium. It's a hyaluronic-based gliding gel, which helps especially on the face treatments where it's not even. So because this is a bit thicker, and so it stays where I put it. This helps a lot during the treatment, that there's no liquid running around. And that really helps you during the treatment to work fast and smart.
Nó cũng là HA gel.
Now I set up the device a bit longer, so up to 1 millimeter of needle length, and try again. You can take a close view on here. Visualized in the picture. I see it that already small blood spots are coming out. This is the feedback I need, especially because now that she had a numbing cream on before, the vessels are tighter together. If you're using high potential numbing creams, we just said a little bit as far as I know, it is not the hardest ones, but doctors also get potential numbings in the offices, and that means if you use the numbing cream, the blood response needs more time. Especially if you're a beginner in the microneedling, start from the bottom up, as I do, 0.5, 1 millimeter, maybe 1.5 on the cheeks. And this is really deep enough for an anti-aging or here an atmospheric treatment. So now I go ahead. course, the skin is thinner and I have bone beneath. So the skin is not swinging that hard. So I start again with 0.5 and have a look how the skin reacts. And you see on the forehead, already now I got a pinpoint here. It's just 0.5 millimeter. If this is really what I mean, if we promise something, the device does that. If I show on the scale 0.5 millimeter, it is 0.5 millimeter in the skin. Really. So on the forehead, I would leave it like that. It's enough. You got a nicely pinpoint blading, and now I treat with this needle length adjustment the whole forehead.
Cái này chắc với em là hồng ban thôi.
Cũng có rỉ máu nhẹ.
Cái này độ sâu 0.5 bị máu là không?
Để da trắng.
You can have a short look on the forehead. As you see, it seems a bit bloody. It is really just a bit, of course, due to the satire. It looks a bit more than it is. You will see if I wipe it off. There's no blood coming out anymore. If I just wipe it once and get it off, there's no blood coming here anymore. So the wound is already closed again. Yes, this is for sure after 10 minutes, but you see already now, after 1 or 2 minutes, it's like the wound is already closed. So this is the difference if we're using the ultramatic needles. This is really a huge difference in comparison with other devices. You have less damage in the skin, you have less traumata in the skin, and the wound healing process goes much faster. The skin is the best way to do it. So, we do the other side.
Cái này không có cái gì cũng có HA gel nó tốt rồi ha.
Đúng rồi. Tại cô anh chị này thì cũng có vấn đề gì mà phải. Ví dụ như nếu mà chị muốn thì sẽ pha mấy cái sâu hơn, với lại chị sẽ pha mấy cái gì hết á. GF chứ.
Cái HA gel là chắc của hãng nhỉ?
Ừ.
Bây giờ lấy sinh số lỡ nước phi lên cái mặt mình. Cái này chắc là hồi như cái da liễu nào cũng có.
Đúng rồi. Đúng rồi. Cái cơ bản à.
Cái này là mình đang đi chơi mình sinh viên mình có tiền
I said if the skin is trying to react, because some of the things only needs a little time, I say that I can go up with the needle length, another 0.25, so I'm now on 1.25 millimeter needle length. this is sterilized the limb around on the right depths for the treatment. And now, as I like you go on by treating around the nose and the lips. I don't go on the red of the lips. I stay away from the red part of the lips. I'm just treating the area around. Lips and nose are very pain sensitive. There are a lot of nerves and I couldn't do it there with this needle length now. So I reduce it again.
Đúng rồi, làm hết. Không, bên mắt không có đi vậy. Đi rồi đó, ta đi rồi đó. Dạ đi rồi đó. Cho nên là vậy là đi rồi đó, không có đi vô sâu nữa. Em không đi đâu. Làm mấy cái khác đi. Mắt gì phải làm cái này.
Okay for you? Just for the demonstration, is it clear what I did now? I could now move further forward, treating also MAC and the décolleté. It's also possible. The needle cartridges will stay sharp. The needles are staying. You could treat the whole body with one needle cartridge, but it's single-use, sterile, one patient, one treatment. For now, what you see now on here is I have an even redness on the cheeks and also on the forehead, also on the nose. This is the good thing on the electrical microneedling. It's very easy to explain. It's very easy to set up different needle lengths, and it gives you security by doing the treatment. Now I'll wipe it off. So yet you see what I've promised, that the skin is already closed again, and that there's not upcoming more, that there's no blood upcoming anymore. Feel free to ask questions. If there's someone who has where this technique is new, or you have some questions, ask. There are no bad questions, just questions. Finished now, put on the mask. Yeah, sure.